So at this time, I would like to bring up and introduce our moderator of this. This is Carrie Wang, who's the Director of the Health and Mobile Research for Parks Associates. So he works for Spirit. And Harry has a research background which is involving studying U.S. disease management practices, the PBM industry, and the specialty pharmacy sector, as well as the clinical and genomic information software applications. I've seen a lot of Henry's research. It's been fabulous. I'm a big fan of Henry. I've seen him moderate panels at other events, so it's a distinct pleasure to get to meet him and to have him moderate this panel for you. So let me introduce you to Harry Wang.
Thank you, Susan. Thank you for the event organizer of the Silver Summit event, as well as continue to sponsor and actually stimulate discussion and brainstorming session for pushing for the digital health as well as personal health technology industry moving forward. And I think if you attend the whole session from morning until now, you probably understand that the healthcare industry is clearly at a crossroads in terms of the next move and how to make changes that make the system more sustainable in the future. And I'm really glad that the Silver Summit put together this event, and the Human Health Alliance has put a lot of trust to organize this panel to give you guys a kind of idea of what are the use cases, what are the technologies, and what are the opportunities for all the constituents in this industry to go from a common goal and drive the changes necessary for the healthcare industries. We have 5 distinguished panelists on this session, and some of them represent the clinical side, some of them represent the technology side, as well as the medical device aspect of that. And before I continue, I want to call the audience to give our panelists some of the perspective on who you are, what's your interest level, and based on your interest background. So raise your hand if you are from a clinical side, either from a payer or healthcare provider, hospitals. Okay, we have about 5 or maybe about 10 people here in this room. Raise your hand if you're from the CE side, device or medical device side. Raise your hand. Okay, about the same number of people. If you're from an enabler perspective, either you provide software or silicon or providing the middleware solution or any of the solution application goes into the device or the service components, raise your hand. A little bit more than that on the device side. And if you're a press, raise your hand. Blogger included. Good. And finally, anyone from the retail side. We do have Best Buy here, so I guess. Good. Well, it is there's another lady here. Okay. It is my great pleasure to introduce these 5 panelists here. I will make them to introduce themselves, and you have up to 5 minutes. Oh, I'm sorry. You have up to 2 minutes, but the shorter is definitely welcome. Okay. I will run this company information on the background, so you can understand who they are, what kind of organization, and some of them wear different type of hats. Let's first go to Kaiser.
Hi, Mike Robkin from Kaiser. I apologize in advance. I have a bit of a cold, so I'll speak slowly and try to enunciate. I work for Kaiser. I'm in IT. I'm a principal enterprise architect. At one point, I owned our national system strategies for medical devices, medical imaging, laboratory, and pharmacy. Now I'm focused on external relations, so talking technology issues with the FDA. And I'm also on the board of directors of Continuum and chair the very working group. So I'm sure you've all heard enough about Continuum. So just let me tell you a little bit about Kaiser if you're not familiar. Kaiser is the nation's largest not-for-profit health plan. We are fully vertically integrated and fully capitated. And what that means is that we are the insurance company and the doctors and the nurses and the hospitals and the clinic and the technology support staff. So we are one-stop shopping for healthcare. We have 8.7 million members. About a quarter of California is insured through Kaiser, and we have facilities and members in 9 other states. So you can see we're not too small. 32 medical centers, building new ones, over 400 clinics. We have our own pharmacy systems, our own diagnostic, our own laboratory, and the current inventory is over 200,000 medical devices. So we are extremely interested in how this technology works. We're very excited about Continuum and other standards organizations because we have a huge investment in our own IT, our own health record, and those sorts of systems. We're a little tired of paying extra to integrate this. And since we're taking care of our patients and we're paying for it ourselves, we get and pass on the whole value of the data that's collected. So if we have better data on our patients, we take better care of them, and we get better results.